I was first diagnosed with Dupuytren's disease in the early 90s. And for a very long time, I didn't think too much about it. It wasn't debilitating in any way. I didn't lose strength. I had full mobility. But over the years, it grew. And in 2008, I was involved in a clinical trial for a new enzyme injection called Xiaflex. And I took part in the clinical trials in Rockford, Illinois. In 2010 or 2012, maybe 2012, I think, I had another enzyme injection. This time, the drug had been way past approved by the FDA. And so then I could get it through my doctor. So that's 10, 12 years ago. Well, the Dupuytren's disease has continued to progress, and my fingers are contracting more and more, and it's not painful really, but it's a little achy sometimes, and it's annoying, and I can't hold a glass. It takes effort to hold the glass with my right hand, which is where the Dupuytren's is. So I finally decided to have the surgery. And I had the surgery on this past Friday, which was the 9th of February, 2024. And here's my hand for now. This dressing, this big bandage will come off tomorrow. And I'll go into a smaller bandage and a splint. And I think all of that is removable because I won't have to wear the splint full time. And I'll need to start exercising my fingers. The process was that they did a nerve block. So they identified this bundle of nerves in my neck that affects my arm. And they did a nerve block. And then I was under intravenous sedation. So I don't remember anything, thank God. And I woke up in the recovery room, and my arm was in a sling. And this arm was completely dead. I couldn't feel it. It just dropped like a piece of meat off of my shoulder. And they said it would last 18 to 24 hours before I would have feeling, and it did. So that was the weirdest part because I couldn't move my fingers. I couldn't use my hand at all. I couldn't use my arm. I couldn't use it to grab things or whatever. So that was on Friday. When I woke up during the night on Friday night, I could feel some sensation returning. And by morning, I could move my arm, I could move my fingers. And so much better, much easier to do things. I'm pretty good with my left hand, thank God, but not with everything. So it's a challenge, but it's not the worst thing in the world. And as far as pain, I did take some ibuprofen the first night. They told me to take some before bed because then when the sensation returns, I might be in pain. So I did, and I took maybe 1 or 2 pills the next day, which was Saturday, yesterday. And today is Sunday, and I'm not taking anything. I feel it a little bit, but it's not painful. And if it hurts, it's because I'm stretching my fingers. So that's where I am today. We'll see where I am tomorrow, and I'll check back with you then. I went to the doctor yesterday to have the dressing removed. They took off the big bandage and the drain, and And my hand looked really good. I was really surprised. The swelling was really, really minimal. From the palm, the back of my hand, you couldn't even tell I had surgery. In the palm of my hand, of course, there are the stitches, and I'm going to post some pictures. So the dressing came off and they made a splint for me. Here's my hand now. And they made a splint for me, which took forever, and I'm supposed to be wearing this all day, every day, morning and night. You can't move in it. You can't do anything. It's even more debilitating than the big bandage with the drain. So I take it off when I need to do something, which is quite a lot. Although, I have my downtime. So if I'm reading or taking a nap, I put it on. But otherwise I can't type with it, and I do a lot of work online, and I can't do much of anything in it. I can't blow dry my hair. I can't, I can get dressed. But anyway, so here's what it looks like, and I'm supposed to wear it all day. Can you imagine? I mean, there's no flexibility. I can take this finger out because it's not affected. So I can do this, but really, and I doubt that they think you're going to wear it all day. They can't possibly think you're going to wear it all day, every minute, except when you're taking it off to do your exercises, which you're supposed to do 5 or 6 times a day, which I am doing. And, but otherwise, I'm wearing it as much as I can. And so there we are. So I think they do that on purpose. They tell you all day, day and night, every day for 2 weeks, knowing you're not going to do that. So they're erring on the side of excess. Anyway, at least in my case, because I don't like to follow rules. And I do have things that I need to get done. So anyway, I'm very pleased with the surgery so far. It seems like a big success. My hand is really flat. I mean, obviously it's in this splint, but it's pretty flat. I can't exactly flatten it on a table yet, but it's because it's sore. The stitches are healing and whatever, but so far I'm really pleased about this process. Today is February 24th, 2024, and it is 15 days after my surgery for the Dupuytren's contracture. In the beginning, in my last video, it was right after I had the big bandage taken off and everything was fine, no pain. It looked good, hardly any swelling. And then we took a little turn and they told me it was normal, but it was kind of frustrating because I thought this was going to be so easy. But I had a bad few days where it hurt a lot and I wasn't as flexible as I was in the beginning, right after the surgery. And it hurt quite a lot. It hurt to put it in the splint and to keep it in the splint. But I went back to the doctor, and of course they told me it was all normal and everything was fine, but then they put me on an antibiotic because maybe it was infected. But anyway, so that was a few days. And then after I started the antibiotic, which was Friday, 2 days ago, yesterday, maybe it was Thursday, I don't know. But anyway, it almost immediately, things got better. So here's my hand now, and it's looking pretty good. There's still some swelling here. I no longer have to wear the splint, and Here it is. I'm not going to do a close-up because there's some like dead skin that's not very attractive, and I don't want to gross you out too much. So anyway, now I can once again make a fist, and it's pretty flat, still swollen here, so. But yeah, so I'm really pleased. And I don't have to wear the splint during the day, although sometimes I do, just because it feels like it needs to stretch out. And the splint is to keep it from retracting. Sometimes the scar acts like the Dupuytrens did, and it'll pull your fingers in. So I wear it once in a while during the day, but I do wear it at night. There's a little soreness still, but I'm I'm not exactly back to normal, but getting there. And I'm really pleased with the results so far. So far, so good. Hi there. It is 3 weeks after my surgery for Dupuytren's contracture, and so I'm just giving you an update, and this will be my last recording. So my hand, here's my hand. There's a lot of skin that's falling off. I know it's ugly, but it's pretty straight, not quite as straight as my other one, but I think it's still a little swollen here. So I think that may get better, but it's really so much better than it was. And I'm pretty much able to use it fully. The scar is still a little sensitive, but for the most part, I'm able to lift things and go about my normal life. And I'm still wearing the splint at night, which I'm told I'll have to do for 4 to 6 months, which is no big deal, but that's just to keep it from contracting. So all in all, I'm very happy with the results, and much happier than I was when I did the injection. So if you're trying to decide whether to do the injection or to do surgery, I kind of wish I had done this surgery a while back, but whatever, it's all good. And that's my story.